Good morning, everyone. Today, from question number 146. A woman who reports painful urination during or after voiding might have problem in which of the following location? Option A bladder, option B kidney, option C ureters, and option D urethra. पेनफुल युरिनेसनलाई डिस्युरिया पनि भन्छ जुन चाहिँ युटिआईमा मेन हुने गर्छ हैन पेनफुल युरिनेसन युटिआईको केसमा चाहिँ बढी हुन्छ यो मेनली इकोलाईबाट चाहिँ लाग्छ र यो भनेको caused by the urethritis. So the right answer is option D, urethra. Question 147. Codly white discharge during per speculum examination indicates option A trichomoniasis, option B candidiasis, option C bacterial vaginosis, and option D cervicitis. Candidiasis means monialiasis, which is a fungal infection caused by yeast that belongs to genus Candida. And the most common species is Candida albicans. यसको धेरै टाइपहरू चाहिँ हुन सक्छ. Question number 148. Causative organism responsible for monaliasis. Option A Candida albicans, option B Tinea curis, option C Staphylococcus aureus, option D Gonococcus. Right answer is option A Candida albicans. Question number 149. Inflammation of vaginal epithelium caused by Candida albicans is known as option A monilial infection, option B trichomoniasis infection, option C Barthonian gland infection, and option D cervicitis. Option A is right answer. Question number 150. Inflammation of lining of uterus is known as option A vaginitis, option B endocervicitis, option C adenomyocytis, and option D endometriosis. Lining of the uterus means कुन पार्ट भयो endometrium. Endometrium को infection लाई endometritis भन्छ. Inflammation of the lining of the uterus is called endometritis. Option D is right answer. Adenomyocytis and adenomyometritis means beginning invasive growth of the endometrium into the muscular layer of the uterus. Inflammations of the mucous membrane that lines the uterine cervix called endocervicitis. Question number 151. Which statement by the client indicates an understanding of the preventing measures of genital tract infection? Option A, I can touch anytime I want. Option B, I should avoid the use of condoms. Option C, I can wear any tight fitting jeans. Option D, I should wear underwear with a cotton panel liner. Genital tract infection नहुनको लागि cotton clothes चाहिँ युज गर्नुपर्छ. Option D is right answer. Question number 152. Genital tuberculosis occur mainly in women in the following organ. Option A fallopian tube, option B uterus, option C cervix, and option D vagina. Genital tuberculosis mainly fallopian tube मा हुन्छ. Option A is right answer. Question number 153. Disorders of uterine tube and ovaries are option A acute salpingitis, option B ectopic pregnancy, option C tumors, and option D all of the above. All of the above. Option D is right answer. All disorders are related to the uterine tube and ovary. Salpingitis means inflammation of the fallopian tube, which are result of sexually transmitted infection. Ectopic pregnancy most commonly occur in fallopian tube, and tumors can occur into ovaries, most common, and fallopian tube. 154. Inflammation of the fallopian tube is called option A salpingitis, option B endometriosis, option C vaginitis, and option C cervicitis. म्याक्सिमम स्टुडेन्टहरूलाई यो क्वेसनको एन्सर थाहा होला। The inflammation of the fallopian tube is known as a salpingitis. Option A. Question number 155. Following conditions is one of the indications for vaginal dodge. Option A. Postpartum period. Option B. Pregnancy. Option C. Vaginal hemorrhage. Option D. Foul smelling vaginal discharge. Foul smelling vaginal discharge is abnormal. Option D is right answer. Question number 156. Abnormal proliferations of uterine endometrial tissue outside uterus is called. Option A. Cystic fibrosis. Option B. Endometriosis. Option C. Metorrhagia. And option D. Menorrhagia. Endometriosis means the presence of a functioning ectopic endometrial tissue outside the uterine cavity, which is mainly confined to pelvic area. Option B. Question number 157. A 28-year-old woman is scheduled for a bilateral salpingo-oophorectomy. What is the priority concerns to be addressed while obtaining informed consent for the surgery? Option A. Risk of hemorrhage. Option B. Acute pain. Option C. Chronic lower back pain. And option D. Loss of childbearing potential. Loss of childbearing potential. Option D is right answer. Question number 158. Nurse caring for a patient with a breast mass may have to know that all the following facts are true regarding fibrinoadenoma of breast except option A. Relatively non-tender mass. Option B. Moves freely inside breast. Option C. Occurs in a postmenopausal woman. And option D. No treatment. Excision biopsy is usually done. Occur in postmenopausal women. Option C is right answer. Question number 159. Physiological ability of women to reproduce is option A. Fertility. Option B. Sterility. Option C. Infertility. And option D. Primary sterility. Physiological ability of women to reproduce is fertility. Normal हो यो. Option A. Question number 160. The inability to conceive a child after 1 year of regular sexual intercourse unprotected by contraception or the inability to carry a pregnancy to term is known as option A. Infertility, option B. Amenorrhea, option C. Endometriosis, and option D. Dysmenorrhea. फिजियोलोजिकल एबिलिटी छ भने फर्टिलिटी र छैन भने चाहिँ इन्फर्टिलिटी हुन्छ अर्थात् यसमा के हुन्छ 1 इयरसम्म चाहिँ रेगुलर सेक्सुअल इन्टरकोर्स अनप्रोटेक्टेड बाई द कन्ट्रासेप्सन छ भने चाहिँ इन्फर्टिलिटी हुन्छ. क्वेसन नम्बर 161. What does infertility means? Option A. Failure to conceive. Option B. Uterine fibroid. Option C. Pregnancy at 8 weeks. And option D. Conceived. Infertility means failure to conceive. Option A is right answer. Question 162. Physiological sterility is present in which of the following conditions? Option A. Tuberculosis. Option B. Endometriosis. Option C. Before puberty. And option D. Asman syndrome. The right answer is option C. Before puberty. Asman syndrome भनेको हुन्छ secondary amenorrhea related to endometrial scarring. Question number 163 in other lecture. Thank you so much.